My name's Caleb Black. I'm a clinical psychologist and a professor at the University of Central Oklahoma. My background is in working with people who have severe mental health problems, primarily things like obsessive compulsive disorder, tics and Tourette's, trichotillomania, which is compulsive hair pulling, things like that. And then on the teaching side of things, I've been teaching about critical thinking and sort of advanced counseling and therapy techniques, assessment, and things like that for this is my 11th year being a professor. And so I've been secular for a very, very long time and have been kind of increasingly involved in that community, especially since we moved kind of back to Oklahoma in 2009. And as part of that, in 2013, I guess, I learned about this thing called the Secular Therapy Project. And it had been launched by Dr. Darrell Ray, who is the founder of Recovering from Religion, which is a sort of a broad umbrella organization that's all about trying to help folks who have stepped away and out of some sort of religious faith adjust to that because, a lot of times folks have difficulty adjusting to either that loss of community or sort of that loss of identity and things that come with a lot of times people becoming non-religious. And as part of that, when he was doing various talks and things, Dr. Ray, who's a psychologist, had a lot of people coming up to him and sort of complaining or asking, saying, where can I get help? Where can I get mental health help? And he talked to a lot of people who had actually had pretty negative experiences with mental health providers who would blame their depression, anxiety, marital problems, and things like that on the fact that they weren't religious. And so they would end up saying things like, well, you just need to, find God again, or trying to proselytize to them once they found out they were non-religious. And so he came up with the idea for the Secular Therapy Project and launched that 4 years ago or so. And I came on board as a therapist initially, applied to the project and was a therapist. Then I took part in being what we call our evaluation team, which actually looks at all the applications for people who want to be therapists on the website. And then starting last January, so January 2016, I actually took over as director of the project because he was wanting to move on to do some other things. So that's sort of how I got involved in it. Now, in terms of what it is, it's really a matching service. And it's a service that takes folks who are seeking mental health treatment and tries to match them with appropriate, secular, licensed, evidence-based mental health clinicians. So it's a little different from a lot of the other services out there, like, for example, Psychology Today or things like that, where you just go in and you search from their website and find a mental health clinician and contact them. Ours is different because we actually vet the therapist very carefully to allow them onto the site. We make sure they're appropriately licensed. We make sure that they are secular, so we don't allow folks who are religious. And then third, and this is the thing that really kind of is unique about us, in addition to the secular part, is that we vet them to make sure that they do what we call evidence-based practice. And that means using our best, most current scientific evidence to guide what you do in the therapy room, rather than relying on intuition or what you wish would work, or, well, this is what I was trained on 15 years ago, so of course it's fine. And so that means that we don't just let anybody in. We actually have a rejection rate for our therapists of around 35%, which makes it a fairly unique group. And then what people do is on the client side, they sign up, they put in where they are, kind of what they're looking for help with. And then based upon their geographical location, they can then search for therapists within a 5, 10, 15, 50 mile range of where they are. And then they can contact those therapists that are on the site. But another thing that's unique is it's all anonymized. So if I was a client and I contact a therapist, they don't know my name and I don't know their name. And we do that because, unfortunately, a lot of our therapists still have to be, in the closet, as it were, in terms of their secularism, or otherwise they would lose business. People wouldn't come to them, particularly in parts of the South and the Midwest. But what happens is, I would contact somebody, and then if we both agree that we're a good fit based on what their problems are and kind of where they are, insurance that you take, things like that, then it's up to you to then schedule those meetings. And then our job is basically done. So we just kind of set up and facilitate people being able to find each other.
Okay. Yeah, and I really like that. I've actually tried to find people before on the Secular Therapist Project to find it to be, very useful and everything like that. You
Great.
mentioned people like doing things differently than they did like 15 years ago. I was reading that there's actually more religious therapists today than there was like maybe 20 something years ago.
Yeah, and I think that's accurate. And it's accurate for a couple of reasons. One is the rise of a number of kind of master's level training programs that are coming out of religiously based colleges. And so they're specifically training people from usually a Christian, usually a fundamentalist Christian point of view in terms of how they think that therapy should happen. And so we've seen a rise of folks like that who they may not necessarily call themselves Christian counselors, but they're counseling from a Christian sort of perspective, whether or not they let you know that. And that's very much fine if you're going to advertise yourself as being a Christian counselor or a Muslim counselor or a Buddhist counselor or something like that. But if you're doing that and not advertising yourself that way, where you're just kind of drawing people in and they think that I'm going to someone who's going to be secular, who's not going to be placing their own beliefs into the therapy room, then that's a little misleading.
Mm-hmm. Yeah, definitely. I was going to ask you about that, about your feelings on labeling whether you are, religious therapist or not, because of what that patient might experience.
Yeah, I mean, if you are a Christian counselor and you're saying I'm a Christian counselor, that's what I do, I think that's fine and that's great. And that way, that's a completely appropriate ethical advertising in terms of what services you offer. But if I'm doing that, but I'm not letting you know that, then that's a problem, right? That's a fairly major concern.
Yeah.
Now, the vast majority of our mental health clinicians that are out there are religious, which is perfectly fine because most of those folks don't bring their personal religious views into therapy because it turns out that's unethical. The vast majority of the practitioners that I know are religious, and I'm very comfortable in terms of me being able to refer to them because I know they won't do that. They won't proselytize. They won't try and push their own beliefs on someone. In other words, I know that they're being competent, ethical professionals. Now, the problem, unfortunately, is that there's a fairly decent subset of folks who feel that they can use the therapy room as some sort of a pulpit to proselytize, to try and cajole you into, seeing the error of your ways as a non-religious person. And it's those folks that you have to watch out for, and they're why the Secular Therapy Project exists.
Is there any kind of process, like if you were a patient and that was happening to you, where they were proselytizing to you, is there a process for someone to report that or do something about that?
Certainly. At the sort of state level, each one of our professions, whether you're a psychologist, psychiatrist, social worker, counselor, marriage and family therapist, whatever you happen to be, there are boards at the state level that regulate that licensure. And as part of that, they also take complaints and field complaints about folks. And so if you have been proselytized towards, if you have been, told your depression is because you're an atheist and you need to just get right with God, That's clearly unethical behavior. And so reporting to your local board of behavioral health or psychology is completely appropriate to do, especially if the therapist has said something about that, said something about, have you tried going to church or whatever? And then you say, well, I'm not religious, and they don't back off. Because, it might be, and I oftentimes to my religious clients that I see personally, that's a great way to get social support, right? That's a great way to tap into a community. But if someone tells me that they're non-religious, I'm not going to start telling them, maybe you really should go to church though, right? Like you should start thinking about that. No, I should try and help them find other things. And so if, I reveal that I'm non-religious, I say that I'm not interested in these things, then you continue to push me on those. That's where our problem is.
Okay. And also just speaking about, religion and therapy and mental illness, do you feel if there is any kind of relationship between mental illness and religion, and what is that if it is existent?
There's not necessarily a relationship between either being atheist and having mental health problems or being religious and having mental health problems. What our research that's out there shows is that early on, it looked like maybe if you were religious, you had better mental health. But more detailed analyses and studies that have followed up on that have found that it's actually, regardless of whether you're religious or non-religious, it's the amount of social support that seems to be a super big predictor of your mental health. And so that's why the religious initially looked a little bit more mentally healthy. But when you control for level of social support, what you see is that's the key factor. I can be religious and have not a lot of social support, and maybe I'm going to be less mentally healthy. I can be an atheist and have tons of social support and friends, and I'll be equally mentally healthy. So it's really that social support aspect that's key, which is one of the reasons why things like Recovering from Religion exists. And it sounds like that's what you guys are trying to do there in Denver with the Secular Hub as well, is to build that kind of a community up so that we can have that support.
Right. Yeah, and they do have a section of Recovering from Religion that meets at the Secular Hub.
Oh, one of the support groups. Yeah. We've got these support groups. We've got the Recovering from Religion hotline and chat line, which are great ways to reach out. If you can't, talk to somebody in person, you can call on the phone or you can do a live chat just via the internet. Yeah.
What are those websites and lines? I could put them up at the end of the video.
Sure. It's just recoveringfromreligion.org. Is our main website, and it's got links to the Psychotherapy Project. It's got links to the Hotline Project. It's got links to the chat line. It's got links to help find a local group. So there's a ton of stuff that you can access just from that website.
Wow. There's a lot of groups out there that, are based on AA, like AANA, SAA, that kind of thing, right. And they all have that sort of higher power component, and I wonder as a therapist, like, what your opinion is on that, on the efficacy of that, and how helpful it is to give yourself to a higher power, or is it better to kind of take that power back yourself?
Yeah, great question. So the 12-step models, which are things like Alcoholics Anonymous, Narcotics Anonymous, Sex Addicts Anonymous, they just throw an anonymous on the end of anything. All of those follow the basic outline of initially what was called Alcoholics Anonymous, which really sort of interestingly kind of sprang out of a cult called the Oxford Group in the late 1920s through the 1930s. And it was very much, if you read about the history of it, a cult. You have these members who are supposed to do these very particular things. They get ostracized if they don't. You have to live your life according to this very particular guidelines, most of which then became enshrined in sort of these 12 steps. So obviously there's a problem when one of those is talking about giving yourself to a higher power if you don't believe in any sort of a higher power or an external power. Sometimes, people will, kind of make excuses about that or say things like, oh, well, your higher power can be anything. It can be a rock. It can be a tree. It's just like, well, that's not at all what you mean, though. And that's not what literally everybody else in there is talking about when they talk about a higher power. They're talking about specifically a Christian God. So even though those are extraordinarily widespread, you can find them in basically every city, AA groups meeting all the time. The research on them shows that they're not any more effective than doing nothing. And so what I mean by that is that if I take 50 people who are having, troubles with overconsumption of alcohol, and I put 25 of them into an AA group, and I just let the other 25 do whatever they want, at the end of a year period, what you see is that about the same percentage of each group has stopped drinking problematically. And it's a very small percentage, it turns out. It's maybe 15% or so. So compared to doing nothing, AA is about as good as doing nothing. Compared to some of our much more effective mental health treatments, whether that's individualized therapy using things like motivational interviewing and cognitive behavioral therapy, or group-based models, we have what we call the SMART groups and things called the matrix models, both of which are group-based, kind of like AA, but they're led by actually a trained facilitator who's a mental health professional. And we actually have great data showing that those work, and they work really well. Much, much better than either doing nothing or just going to AA.
Right.
So I encourage people, if they're struggling with substance use, to look into more evidence-based effective options rather than doing something like AA, whether they're religious or not. But especially because a lot of folks who aren't religious get very turned off by the AA model and kind of its emphasis on God and telling you you're a terrible person and you're an addict and you're always going to be this way. There's lots and lots of that shame and that guilt that's built in there that doesn't help build an effective person, it turns out.
Mm-hmm. And let's see here. Yeah, I also wanted to talk about like religious abuse, like it seems like that's something that when people are in recovering from religious groups, that's a big component of it.
Yeah, unfortunately, a lot of folks have very bad experiences, usually because of fundamentalist religious beliefs. You can see it, in any level or any kind of religious beliefs, but it's much more common in the fundamentalist ones, where you have this sort of highly authoritarian, highly controlling, either a hierarchy or just one particular leader that generally makes it especially bad for females and for children, because males tend to dominate those kinds of groups. Not all of them, certainly, but a number of them. And so a lot of times, unfortunately, what we'll see is lots of fear, so if you do anything that's wrong, if you're sinning, if you're doing this or that, well, then, what's going to happen to you if you do that. You're going to die and burn in hell forever, which as a small child is a terrible thing to say. I mean, that is abusive. You're telling this person that just because they maybe slip up or mess up, that they're going to burn in hell forever. I mean, that in and of itself can certainly count as religious emotional abuse. But we also see huge amounts of physical abuse, whether it's sort of harsh discipline and corporal punishment for children, which is all too common in these kind of fundamentalist backgrounds, whether it's sort of controlling either by a spouse or by a parent or some sort of religious leader, controlling what you're supposed to think, controlling what you're supposed to do, controlling how you're supposed to feel, and then physical abuse as well. When we see a lot of that, where we see tons of spousal abuse coming out of fundamentalist backgrounds, where it's basically not just ignored, but sort of encouraged that, well, if your wife is willful, this is what you do. If your child's willful, this is what you do. You have to physically beat them to show them that you're in charge. And so we've, seen tons and tons of those cases, unfortunately. In many cases, it's not really that different from folks who are coming out of a cult background, where they try to be controlled, brainwashed, cut off from the outside world, adhere to these very strict principles, and they get severely punished if they don't adhere to those. And so we do see lots of folks who have essentially what you could call post-traumatic stress disorder as a result of their religious backgrounds. Certainly not everyone, obviously.
Mm-hmm.
Most folks who are religious don't come from those kinds of controlling, manipulative backgrounds. But for those who are in there, it's very, very tough to get out and can cause huge amounts of problems, both when you're in it and then even after you leave. Because a lot of times you lose any sort of social network that you've developed because they're so controlling about who you can be around. You don't have effective coping mechanisms because all you've been taught to do your whole life is just pray or ask for guidance from an elder. And so a lot of times you're sort of just drifting and astray, suffering the results of huge amounts of abuse for, years to decades.
Right. Sure. I mean, I know my dad grew up Seventh-day Adventist, and he went through all of that,
Yeah.
just all of that kind of abuse, and that, we're gonna be strict, and we're gonna beat you because you didn't do the right thing, that kind of stuff. So it's definitely there, and it took him years to overcome all that. Let's see, what else did I have? So I was also reading about court systems, and when people, do whatever it is to get themselves in court where they have to be mandated therapy, where a lot of judges purposefully send them to more religious counseling.
Well, certainly in terms of substance use, and folks who have DUIs and things like that, a lot of times judges will mandate that they receive substance abuse treatment or attend substance abuse groups. And in most places right now, unfortunately, that means AA, which, as we already talked about, doesn't work for almost anybody, and can be especially off-putting to the non-religious. There have been, instances in other cases of judges, mandating some sort of Christian counseling or something like that, or ruling against, a parent in a custody battle or something because one of the parents is theist and one isn't, all of which is pretty clearly unconstitutional, but unfortunately hasn't stopped it from happening.
Yeah, definitely. I've heard of cases like that. I've heard of not just like AA, but just in general, like the group therapy kind of stuff, anger management, anything like that,
Yeah.
Yeah.
Turns out probably isn't going to be that effective.
Right. Well, and I wanted to, go back to your books. Like, I was really interested in the Psychology Gone Astray book because of the racist, sexist lit from early psychology research. Like, just, that's always kind of fascinated me. Like, I read Women in Madness before, and just the way that it's kind of been used in a prejudiced manner against certain groups of people.
Yeah. I co-wrote that with a professor at Oklahoma State, who was one of my mentors, Charles Abramson. And he teaches history and systems courses on psychology. And we came together and put this book together, and it's basically sort of showing, here in the early psychological research, we like to think of science as being sort of objective and perfectly reasonable and rational, but we have to remember that the people doing science are people, right? That's what they are. And it turns out that people are enmeshed in the time and culture that they are in. And so what we did is we sort of found and then reprinted a bunch of early articles from about 1892 up to 1927, showcasing both examples of science done well, looking at racial minorities and females, and science done poorly. And it's pretty eye-opening for a lot of people to read these early studies and see, just from our perspective now, how overtly sexist they are, or how, sort of purposefully gamed the design was to make sure to show that, black people are not nearly as advanced as white people, or females aren't nearly as advanced as males. But at the same time, during that period, we also have some women who are doing this outstanding, amazing research and doing it well and doing it right. and showing that, well, in general, females actually do have a little bit higher verbal skills than males do. Or no, there's not really racial differences between things like reaction time. And so it was interesting for us to sort of go back through, 130 years ago, basically, and start looking at these studies, some of which were conducted and published by extraordinarily well-known, very influential psychologists, people who are mentioned in intro psych textbooks. But these things aren't mentioned, right? Mm-hmm. Nobody sort of talks about that. And so we were really focused on trying to use this as a teaching example. Here's what you can do if you let ideology drive your research rather than letting your research be more objective and setting yourself up to have, true results.
Right. And another thing, going back to like just different groups that have issues in psychology and that kind of thing, is I'm always curious about the retraining programs for like the LGBT groups, like how
the conversion therapies and things like that. Yeah, which are obviously highly unethical. And several states have banned them now, which is great. The analogy that I often use when people try and tell me that they do work or that they can work is, okay, well, so could we do the reverse? Could I take you, if you're straight, and then put you in a gay conversion camp and then convert you to be gay? Do you think that would work? And people are often just sort of aghast. They're just like, what? No, you couldn't make me gay. I'm like, why do you think you can make someone straight then? Oh, well, it's a choice. I'm like, okay, well, when did you choose to be heterosexual then? And people are, well, but I just knew. Okay, so why do you think theirs is a choice then, right? It's obviously not. It's not any sort of conscious decision. And so, that's a good example of letting religious ideology about homosexuality being unnatural or chosen drive some sort of therapy system, which is highly pseudoscientific, and it turns out highly dangerous. We see large numbers of folks who go through conversion therapy who do worse mentally afterwards and have higher rates of anxiety and depression, even suicide and things like that.
Is there anything today that's like accepted psychology practice that you think one day will be kind of seen in the same light as like a pseudoscience-y sort of thing?
Yeah, that's a great question. There are a large number of practices that are widespread that are actually, we know are pseudoscientific right now, but they're still widespread. The two biggest, just sort of off the top of my head, one is called EFT, or emotional freedom techniques. And that's where you take your fingers and you tap various parts of your body while repeating certain phrases. And the people who use it liken it to like psychological acupuncture, which is funny because acupuncture is also bullshit. And so that's a big one that we see people, using or being trained on, these tappers. And it's complete nonsense. Doesn't work, doesn't help you. It's in no way based on reality, but a lot of folks do it. And then another one that is highly pseudoscientific is what's called EMDR, for eye movement desensitization retraining. And this is a therapy in which mostly it's used for trauma. And so what you do is you're supposed to, set back, and then you start thinking about a traumatic memory. And while you're doing that, initially what you would do is you would move your eyes back and forth, back and forth, back and forth while you're saying this memory. And the person who originated this said that, well, that's helping to reintegrate the sides of your brain and to help them, heal from this trauma and get better. And then she moved on to saying you can do other, what they call bilateral stimulations. So you can move your arms or you hit your legs or something like that, as long as you're engaging both sides of your body and talking about this traumatic thing, then that helps your brain heal. Well, it turns out that's nonsense. because we've done dismantling research where we take just pieces of that and see what happens. So we just take the piece where you just sit there and talk about the traumatic experience, and then pieces where you just do the eye movements, and then combine the two. Because we've known for a very, very long time that the most effective treatment that's out there for trauma is what's called exposure therapy. And this is where you carefully and in a planned way expose yourself to the memories of the traumatic event repeatedly to help decrease your reactivity and your emotional response to those. And so it turns out if I'm just sitting here talking about this traumatic event, what am I doing? I'm doing imaginal exposure to this trauma. The movements, eye movements or arms or whatever, do nothing. This is a good example of what we call a purple hat therapy, where you take something that we know works, like exposure therapy, and then you add something on top of it that is nonsense, but then you attribute any success to what's been added on. So if I have a treatment for depression that I know works and I bring you in and then I have you wear a purple hat, and then your depression gets better, and I say, well, it's because of the purple hat, right? It's a magic purple hat. No, it's because of the other thing you did. It's no different than if I take, I have a headache and I take Tylenol and then I, do this. This doesn't help, right? That's not helping. What it was is the Tylenol helps. So EFT and EMDR are two I think the most widespread sort of pseudoscientific practices. And it's unfortunate because we have things that work and work very, very well for trauma, anxiety, depression, and most other mental health problems.
Right.
But a lot of people don't get trained in those, unfortunately.
Yeah, and that is unfortunate. And I actually did. I tried EMDR for some stuff I've got going on, and it was like the noise one where they do the different speeds in your ear, and it's just like, what am I doing?
And it turns out it doesn't do anything.
Yeah, exactly.
It's just nonsense.
So. Complete and utter nonsense. Well, let me think here. I think you've answered everything that I had originally thought of. So if you want to talk about how to find out more information about you and the project. And I did see you have a Pathos site. So,
So if anybody wants to learn more about the Secular Therapy Project, you can just go to seculartherapy.org. And from there, you can either sign up to be a client or you can sign up to be a therapist, either way. It's a very simple process to do that on both sides. So if anybody's interested in that, feel free to go there. There's also contact there. If you have any other questions, you can contact us. It all goes directly to me, so I'll hear that. If anyone's interested in learning more about kind of what I do, you can just go to my website, which is caleblack.com or caleblack.com. Either way, spelled the same, works. And then you can link from there to, you can see my books, you can see my teaching and my trainings, you can see my YouTube channel with various videos on it, as well as linking to things like my Great Plains Skeptic blog that I run.
All right, great. Thank you so much. And thank you for doing this. It was really great.
Thanks for having me on, Melissa. I really appreciate it.
Oh, thank you. All right. Well, yeah, really, seriously, thank you. And I really learned a lot. Yeah.
I was happy to. And let me know, how things go, and send a link to it so I can spread it around. Hopefully get you guys some more listeners.
Oh, that'd be awesome. Yeah.
See how things go. I'm not Hamet with 1 million followers or anything. But I've got a decent little footprint out there.
Yeah. It takes time, but yeah.
It's true. You have to want to work at that and do that. Let me know anything else you guys need or anything else I can do, or trying to hook you up with anybody else, and just let me know.
Oh, great. Thank you.
All right. It's good talking to you, Melissa.
You too. You have a good afternoon.
All right. Bye.
All right. Goodbye.
Thanks for listening to the Secular HubCast. This podcast is a project of the Secular Hub. For more information and to become a member, visit secularhub.org.